Hi everyone, my name is Dr. Kyjuan Brown of the Dr. Brown's Hair Restoration Clinic, and this podcast is restoring confidence one strand at a time. In addition, we're going to learn and we're going to listen to the journey of patients who are going through the hair restoration process. How we're restoring one hair strand at a time and restoring confidence in many of these individuals and their personal lives.
20 years younger with Carlos.
So let's talk about that, because everyone thinks that it's a painful procedure. Now, I'll be honest with the people. Is it painful or not?
I'm going to be honest, is no, not pain at all. To me, it was like more a massage when I came up here and the doctors done it to me.
So it sounds like a massage?
Yeah, it's like a massage. Yeah.
Even when I did the initial scalp block?
Correct. I did not feel any pain.
Not even a tinge?
Nothing. I'm going to be honest. The only thing I noticed was the first shot was here on the scalp. The first two shots, you have a pinch, that's it.
Yeah, so what it's describing is that we do a scalp lock. And the scalp lock, we use actually a needleless injector. I should have brought it down. I'll probably show it later on in the show. But we use a needleless injector that shoots numbing medicine underneath the skin. So that's not even a needle. It's just high pressure medication. In this case, it's lidocaine or xylocaine. So it numbs up the skin. So when I do the needle for the scalp lock, you don't even feel the needle. You may feel a little tinge, as he said,
correct,
once I get down to the burn. But on a scale of 1 to 10, how would you rate the pain?
I think 0.1, I believe.
A 1?
Yes, because...
Yeah, I think that's reasonable to tell the people.
I believe I was pretty much asleep on a chair when the procedure was done.
Carlos, thank you for coming and joining us
Thank you, Doctor.
on this particular podcast. So, I remember when you first came to me many years ago.
True.
Remember that time? And you had some thinning here in your crown, in your front, and you were saying that the staff members used to tease you or something?
Oh yes, my staff members used to be teasing a lot, my hair keep loose, only like I look too old, and we try to figure out what I'm supposed to do anyway, see. And I'm glad because a couple years ago, when I spoke to Dr. Brown, the first time, Dr. Brown said, come to see me, and he consulted me what to do, not to be down, I think it was about 3 years ago, if I'm not mistaken.
Yeah, it was about 3 years ago.
Yeah.
Because you first came and we did some medical restoration, and we did a great job of restoring what we could medically. And I always told you before that, you're probably going to need a transplantation, but we just never offered it back then.
That's correct, yeah.
Yeah, so, and that's really how this journey ensued, where a lot of my patients, we took them to a point, like restored them up to 80% of their hair loss, and then, transplantation was the next best option to get you looking like this.
Exactly.
And oh my God, you are 7 months out now?
Yeah, 7 months out yet, and just
this is like a toupee.
No, I'm telling you.
This is real.
It is,
It's not coming off.
It's not coming out, believe me, you can push, believe it or not. And the best...
It looks amazing.
The best part this happened about 3 times in Hamilton when I go to Hamilton. People approach me, telling me, hey, that's the guy, you the guy who was in TV, in a newspaper, about your hair. Yes, I need to ask some questions to you, I says, okay, that's fine, you can ask me. He says, hey, how the way works? Was pain, how the way was you, Dr. Brown treat you, or the staff? I says, well, I keep explaining to them what happened, how to it, my journey went through this time, and they're very impressed, believe it or not.
So let's talk about that, because everyone thinks that it's a painful procedure. Now, I'll be honest with the people. Is it painful or not?
I'm going to be honest, is no, not pain at all. To me, it was like more a massage when I came up here and the doctors done it to me.
So it sounds like a massage?
Yeah, it's like a massage. Yeah.
Even when I did the initial scalp block?
Correct. I did not feel any pain.
Not even a tinge?
Nothing. I'm going to be honest. The only thing I noticed was the first shot was here on the scalp. The first two shots, you have a pinch. That's it.
Yeah, so what it's describing is that we do a scalp lock, but we use a needleless injector that shoots numbing medicine underneath the skin. So that's not even a needle. It's just high pressure medication. In this case, it's lidocaine or xylocaine. So it numbs up the skin. So when I do the needle for the scalp lock, you don't even feel the needle. You may feel a little tinge, as he said,
correct, yeah,
once I get down to the burn. But on a scale of 1 to 10, how would you rate the pain?
I think 0.1, I believe.
A 1?
Yes, because...
Yeah, I think that's reasonable to tell the people.
I believe I I was pretty much asleep on the chair when the procedure was done.
Yeah, and that's because we gave them some numbing medicine, some relaxing medicine. We gave them some diazepam, so that kind of makes you very calm and relaxed. Because people are going to be nervous. It's a 6-hour procedure.
Correct. Yes.
And we want patients not to be squirming all over the place, not necessarily to pain, but also just fidgeting from moving, right? But so let's get back to the scalp lock. So we do a scalp lock in the front. Post-auricular behind the ear, and then post-occipital, which is in the back. And as I said, we use a needleless injector, so you're not supposed to feel much. But if you do feel something, he may have a very high pain tolerance, but it may be like a 2 or 3 on a scale of 1 to 10.
I'm gonna be honest, because when the procedure was doing that time in the chair, I know Dr. Brown always keep asking me, and the nurse keep asking me if I have any pain, if I felt anything. I have not, I'll be honest.
Good. And so we're there with you, my nurse is there with you to monitor you as I'm doing the procedure. And also I'm asking the patient, are they feeling anything throughout it? And usually they don't feel anything. So what we do, once we do the scalp lock, then we do tumescent infusion. So then we go with another needle all through the scalp to numb it up as well. So after that you feel nothing for the whole 6 hours.
That's true.
Now, let's talk to the people about the procedure. So you came in for your consultation.
Correct.
We had you shave your hair. How did you feel about shaving?
That's my only thing I see. When I came, I thought the doctor just want to shave the front, that's it. But when the day came and I noticed I have to shave all the head. For me, I never saw myself without the hair, you see. And
you look like a young football player.
Jesus, you know. But believe it or not, it worked out well. I saw myself without hair. Even my wife said, "Why do you live without hair?" I said, "No, it's not going to happen." Seriously. And it was fun, you know. I went to work. The only thing when I went to work, I had to wear a cap. So
yes.
The situation is after the procedure. But it was amazing. No, I'm not. I recommend.
And your hair grew back how fast?
Very fast. I'm going to be honest. A week after, when I came here to consult and to be washed the first couple of days, you know, I feel, I look at myself in the mirror like, it's growing, believe it or not.
Yeah.
I wasn't amused how the things work out, personally, see, because until you do it, you can hear people talk about, but you don't know the results.
Carlos is an unusual case. I think because of his race and ethnicity, you grow hair very fast. So normally we start to see results at month 4. With Carlos, at month 2, I'm like, hold on, did I miss time or something? Because he almost had a full head of hair at a very early stage. And I'm finding that amongst, as we're doing our patients, that span different races here in Bermuda, because we're like a little hosmosh of different cultures here in Bermuda.
Yeah, sorry, doctor. And my friends is where I work, not as my friends. The place I work is a members club, correct? And
very high-end, very exclusive. Carlos is a manager of one of the most exclusive resorts in Bermuda, so he only deals with the high end. I can't even go down to his place. I don't have that type of network. Even though he's trying to sneak me in.
Yeah, that's right. But it was fun because every time the ladies question me, even the guys, right? And they question me, say, "Hey Carlos, can I please touch your hair?" Make sure. They say, "Oh sure, please feel free if you want to touch." They touch my hair, they put, make sure.
No, because it just looks so good.
Yeah.
And it looks natural.
The thing I always, even the members, even today somebody came to me as well, they say how natural it looks as well. You see. And everybody keeps saying, "You look 10 years younger."
Absolutely.
That's very important. Believe me, 10 years young is good.
Absolutely. I mean, as we're getting older, even for me, you know, age is something that runs away, but we're able to do what we can to kind of keep that youth, keep that spunk. And hair is a big part of that. You know, a lot of the guys that are coming in, apart from Carlos, because he had hair, he just had some thinness, especially in his front. But I have some guys that are coming who are completely bald, and I'm like, why are you here? They're like, I want my hair. I want to be able to comb my hair. I want to get a haircut. I'm like, okay, we're here for you. And they look amazing. They absolutely look amazing.
I believe it or not, that the place I work, as I mentioned, people stopping in the street, people at work talking a lot as well, is concerned the hair. The mentality they thought will never grow. As soon as implants come, you don't have to cut your hair anymore. It says not.
No,
it's my hair. It's
your hair.
I need to pay extra now to cut my hair. Believe it or not, you know.
Well, yes, because it grows so fast and it looks so thick and so full. So you're at month 7 now.
Correct. Yes.
And you're not even finished. You know, it doesn't, I mean, it keeps on growing up to month 12 and even beyond that, and it's going to constantly grow as normal hair. But the thickness and the density is going to improve as we get closer to 12 month mark. I think you're kind of exceptional where it looks
I think so.
now.
It looks amazing, I might say. I'm very impressed, very happy with the result, to be honest. I hope I'm into anyone. And please don't think about pain, because no pain at all.
And yeah, we do a great, thank you for that, because I do pride myself on doing a great job to make sure that the procedure is painless, because I hate pain. I absolutely hate pain. And so my mother always told me, do unto others as you would have them do unto you. So this is why I try to make it as comfortable as possible, okay?
No, I ended up in my as well in Dr. Brown's office as well. All the staff is very, very friendly to call you as well, see if you're doing okay, know if you need anything, if you have any pain. That wasn't a problem. It's the first quality, that's the factor. Yeah.
And I think that's a differentiating factor from people who tend to want to go overseas to do it. You know, we treat everyone like their family because we know you and we've been seeing you for such a long time. But even beyond that, even if there's Bermudians here that we have never seen, because we're just down the street, if you have a complication, if you have a concern, you just come on down or give us a call. For those that go to Turkey, they're there for 3 or 4 days and then they fly back to their country of residence and don't have that connection with the providers or the specialists that are dealing with their case, and sometimes can lend themselves to complications. Luckily, knock on wood, this is a wood table. We have not had any complications from any of our patients. We've done over like 60, 70 patients so far.
Yeah, advice I give anybody who wants to do that, please don't be ashamed. You don't have to be private, you know, everybody can know, it doesn't make a difference, you know, it's your life, you know, it's your hair, you know, just do it, you know. Just give a call, you know, almost 100% Dr. Brown's office. We take care of you very well, like they did to me.
Thank you. So let's talk to the people about the aftercare process. How bad was that for you? Because you had to sleep with a neck pillow, you had to sleep upright in a recliner.
Well, I'm gonna be honest, when I left here about the 6 hours and I went to work that day,
You went work the next day?
Yes, I went to work the next day, believe it or not. The only thing it is, of course, my type of work I do, I have to wear a cap. Because, you know, for a couple of days, but I went back to work next day, you know, and I have no pain. So like the doctor says, be careful with the sun, I have a cap, and I have no issues to sleep. I slept the same way, no pain.
And you didn't get that swelling, because when we see patients go to Turkey, they get this big swollen head. Did you have any more?
No swelling at all. That's why even when I came, I think 2 days after, if I'm not mistaken, they come to wash a shampoo and they have it the first time.
Yeah, so they come back 2 days after and we do their wash and their first shampoo and teach them how to care for it.
It was amazing when I came up here, right away, the office take care of me, wash my hair the first time, you know, and I have no issues here. Always I work the next day, went back to work, natural like another habit. The only question was people ask me why I use a hat at work. I have to explain the reason. Was it?
Of course, because you got bandages and you look like you've been through war from your scalp.
And they make me take the hat to show them the procedure as well. They say the next day they did. I said, I'm sorry, don't look pretty because, you know, of course, you know.
You just had surgery.
Yeah, I have to take it off. They look and around, the thing is working. And they said it was amazing. But some of them thought when you have the first implants, correct? The hair never grow. I have to explain over and over again. Yes, the hair will grow.
The hair will grow.
Time. Yeah, correct.
So when we transfer the hair from one area to the next, it's just like transferring plants. So we do that all the time, right? Even in your garden, we take plants from one area and put it in another. Yeah, the roots regenerate and grow.
Because I've had to say because my birthday was last month and
happy birthday.
Thank you. I forgot I have to get my license renewed.
Okay.
If I look the old one, I look the new one, I look younger, the new license, in other words, with new hair, you know, believe it or not.
You have to get a new license photo. Absolutely.
Exactly. The picture looks better what I've done in the past. Because my hair is full of hair.
Yes.
Yeah, it was amazing, believe me. It's amazing.
Yes. We actually use people's license photos when we're doing the restructuring of the frontal line because we want to make sure that it's natural and it's fitted them when they were younger. So Carlos' line that's how it was when he was younger. And we looked at one of his younger photos and was able to match his hairline, and he agreed to having such. The hairline design is something that we do in consultation with the patient. It's really patient's preference. We would draw out the line for you and say, do you like this or do you like that? and they choose what's their preference. And as long as it doesn't look abnormal, it's natural, then the patient can pretty much have what they want within reason.
Yeah, I don't have no problem to take a shower, wash my hair, after the first 2 days I came back here. No pain, just I did what the doctor told me, just go slowly when you wash your hair because it's still fresh.
Yeah, we use a baby shampoo and they have to go slowly. And also we medicate them through the process too, which they probably don't do in Turkey. That's why they get all the swelling. So we gave patients some water tablets that helps you get rid of all the excess swelling. So as Carlos went to work the very next day, you can. Of course, if you're in construction or something outside, that you're getting hot and sweaty, we'll probably advise you to take a few days off. But generally our office workers can go right back to work the very next day. Of course, you're gonna have bandages. Of course, people are gonna be asking you questions, I guess. Or you can simply work from home if that's the case.
Yeah, but I didn't have no issues. It was perfectly, even up to days, after almost 7 months, was done. People still ask me and approach me every day concerns my hair. Every day, believe it or not. It's no ways of good news because always I say is, first thing they ask if it's pain. It's no pain, it's pain-free.
It looks painful. When you see my videos, it does look painful. But if you can hear from the patient themselves, and all of our patients that are giving us a testimony, there's no pain.
No.
Now let's talk about cost. Now people can fly to Turkey for this procedure. And let's talk about the comparison between Turkey and Bermuda. Now we can't always match the Turkey prices because we are Bermuda, but how reasonable was it?
I'm going to be honest, for the price is very reasonable because when I look at the price and see I have to buy the tickets, I have to get a hotel, I have to leave work, and they do procedures overseas. The end of the day, gonna cost me double the money to go overseas.
Absolutely.
And to me, to do in Bermuda is very good because I call home Bermuda.
Of course.
And anytime I need to call doctor, it's like 5 minutes away or 10 minutes drive. I can see the doctor anytime in Bermuda because when he go overseas to do it, he come back home, he never gonna have that special treatment. Or have that friendship with the doctor, with the staff as well, like I have with Dr. Brown. That it was a very, very great idea, smart idea to bring somebody to Bermuda, I must say. Yeah, I'm very happy. I will not go away, I promise you. I will not go away. I did it because it was in Bermuda. If it was for me to do away, I would not do it because it's too far away.
Yeah, taking off from work.
Exactly.
You gotta take some time out of your holiday schedule, the cost of flying and all that stuff. And then transiting now across the world is not as easy as it used to be.
Yeah, I do understand even with the price. I do believe right now Dr. Brown might have a plan to pay for it, I believe.
Yeah, people can pay up onto it until the day of surgery. Don't do post-procedure plans though. But this team comes down every quarter, so you can schedule that accordingly, and then you can, sign a consent form that we take so much off your card every month until the procedure is paid for. But the average cost of the procedure that Carlos will have is around about $4,000 to $5,000, which isn't bad. And that's all your aftercare and everything included.
I agree, because the time you take a week off, you travel, you're away from your family as well, it's...
and of course, he could have went to Turkey and had this procedure very well done in Turkey for $3,500. But as you said, the cost of travel, the inconvenience, the lack of connection with his providers would have cost a lot more overall. I've had a patient that's going all the way to Kenya. I think he paid like $2,500 for his procedure, but it was $10,000 in airfare and travel. But he did it way before us, and he was like, Dr. Brown, listen, I wish you would have did it. But because we've been doing medical hair restoration for over 15 years, so the hair restoration or transplant part is relatively new to our practice. And so we've been sending patients overseas for years. And so they come back, and so we ask them the cost and what their experience is. And in this case, we end up bringing a team from Turkey that have over 25 years of experience that do this day in, day out on various races, including that of Afro here, which is kind of unique. Carlos hair is normally straight coming out of the follicle, but the Afro hair is normally curved. So you need to have a provider that knows how to manage and how to extract the Afro hair. But yeah.
But I want to say something as well, is because the question comes, especially with the ladies, if the ladies can do it. They say, of course, it works for men, works for the ladies as well. Don't make a difference, if you are male or female. The procedure is the same way, see. That's my question.
The only difference with females is depending on their case, we don't have to shave off all their hair. most females just have loss of the frontal line. Sorry, most women just have loss of the frontal line, and they have very long hair, so we're able to open up a window in the back and just shave that area, and then they can just take their hair and just throw it back over the window that we've taken, and we just do the frontal area. If women have to do the crown, then of course you're gonna have to shave, unfortunately. But yeah, there's worse things. Most people are quite fine. After day 10, they can wear some sort of scarves, or if they want to put a wig on or something. For women it's easy. For men, we just gotta rough through it, right?
Yeah,
with a hat.
After 10 days, I have no hats. That's it. Was done.
Yeah.
Was just for a week. That's it.
Yeah.
I took off the hat, but it's amazing the results shows. Anyway, see, people keep pulling my hair. It looks perfect.
Absolutely, I love it. I love it. So, Carlos, I want to thank you for your time and thank you for doing this. You know, not here in Bermuda, oftentimes patients are not willing to do testimonials. Patients are not willing to talk about their journeys, and it's very unique to find patients like Carlos who are like, yeah, I'm happy to tell anybody, because you know, people, it's a small island, so people are private. So I do appreciate you from the bottom of my heart for doing this and just showing people the journey and having them listen to your testimony, and also the journey from having very thinning hair and how you felt and how it made your self-esteem, and then now look at you. You're looking like you're 20-something years younger.
That's right, doctor. Thanks to you. I ended in my saying, everybody in Bermuda, like, for some reason, like, I'm the star now. Everybody stopped me, asking questions.
You are a star.
Thank you, doctor.
And he's an amazing personality, just in his own right. So it just works.
I much appreciate your help, doctor.
Yeah.
Means a lot. Appreciate it. You'll be there.
So guys, thank you for joining us on this podcast. This is just one of many testimonials that we're going to bring for those patients that are willing to do so. And most importantly, hearing their journey, understanding what they had to go through. And of course, do your own research. Google, YouTube are always helpful. But equally so, you can come down to us and we're happy to walk you through it and show you some examples, show you some pictures, and guide you through the whole process. It's possible to restore your confidence if you've lost it as a result of hair loss, and you know, we're here to support you every step of the way.
Up next, dive into episode 4, titled Leading by Example, with Kenton.
Look at the before and after, guys. Let's start off there, first of all. But Kenton, why even do this?
I thought it would be a great idea. We was pushing the business and we was starting to push it out to my clients that needed hair restoration. And I thought, why not get in myself? I thought that I could get my youth back. And clearly it's starting to come back. Yeah.
Look at that. So at what age did your hair start to regress?
I think around the age of 18, 19, 20.
And you're now about what age for the audience?
I'm 40 years old now.
You're 40 years old?
I am, yes.
I'm older than you?
Yes.
But so right about 18 years old, you started to lose some what did you notice most of all?
My line was starting to recede back. Yeah.
So now, talk to the people about what has this done for your confidence, because you're a good looking guy, you work out, you're in the military. No one would have thought that you would have had a deficit in confidence per se.
I mean, I don't think I had a deficit in confidence, but indeed it has made me more comfortable within myself when it comes to my appearance. I have always been a confident person in what I do. I always put my best foot forward in things that I endeavor to do. However, looking in the mirror now and seeing that I don't necessarily have to wear this hat a certain way, I can just rock my hair out and things of that sort, has just made me a little bit strong within my appearance. So confidence has grown in that sense as well. So overall, it's just made me a better person.
I checked the waves because I checked the waves.
That's why I did it from day one.
I love it.